Hi, I'm Dr. Kelly Starrett with H-Wave. One of the real concerns we have across all populations, but particularly in our more athletic populations around surgery, is something called disuse atrophy, which is a very fancy term for meaning that sometimes when I don't use my body the way I've been using my body, I can lose some strength and size and mass. One of the feedbacks we've seen over the sort of years and years and years that we've seen and addressed people having surgery is that we oftentimes will have the surgical leg or surgical arm actually lose some of its muscle mass compared to the less affected side. And what ends up happening is that it's actually quite difficult to sometimes reclaim that mass. And so some people will have a smaller quad, they'll have a smaller calf. And again, functionally doesn't even matter, but ultimately, aesthetically, not very pleasing that I have one side of my body look like the other side of the body. Other thing is that when we have real surgery and trauma, oftentimes we see that people cannot be active in loading for sort of considerable periods of time. And one of the things that we can do by using the H-Wave in both of these situations is keep the brain connected to that muscle. So by being able to access that muscle through this non-fatiguing contraction, my brain is going to think this muscle is in service of the body. And so what will end up happening is that the body will engage in sort of the normal phenomenon of saying, hey, we may lose some strength over the next few weeks because we haven't been able to load, but we're not seeing sort of disuse of that limb. That means that we are able to start loading again and maintain strength and size in the people that we're working with. That can be very, very important in elderly populations who are having a hard time putting on muscle mass, and we want to keep as much lean muscle, sort of active mass on them as possible, but it can make a real difference to athletes in their job and the return to sport or even return to work if we're able to maintain that function. So one of the reasons we're very big fans of early and aggressive use of low frequency pumping with the H-Wave is this allows us to keep the leg connected to the brain through that non-fatiguing muscle contraction. My brain says, oh, look at all this movement that's happening. That's okay, let's go ahead and maintain that lean muscle tissue. We'll see that our athletes who have used H-Wave versus those who don't, it's really significant in terms of sort of maintaining muscle strength, maintaining neuromuscular control, and in this situation, limiting this gnarly situation called disuse atrophy.